Hello everyone, my name is Dr. Giselle Mansour. I am an internal medicine physician. I did my training here in US, Miami, Florida, and I'm very happy to be with you today talking about hypertension. Today, May 17th, is the World Hypertension Day, and it's very important and very happy for me to be guiding you and explaining some facts about this condition. It is very important to have in mind that every day more people is dying from cardiovascular conditions. Every day, cardiovascular disease accounts for more than 50% of the persons that die. From this, 50% die from heart attacks or strokes, and from those, 3/4 are from low or middle income countries like ours. It's very important to know what it is hypertension, what are the risk factors, what could happen if it is uncontrolled, and what are the modifiable risk factors that we can change and how to control it and how to get a good treatment for this condition. Welcome, and I hope you can have some facts and you can understand everything about it. Hypertension or elevated blood pressure is a condition that is silent. Most of the time, you don't feel anything. It's a serious condition that significantly increases the risk to have a heart attack, brain injury or stroke, kidney disease, and even blindness. An estimated 1.13 million people in the world have hypertension, and most of these persons live in countries with very low income or middle income. In 2015, 1 in 4 men and 1 in 5 women had hypertension and it wasn't controlled. And this is one of the most common causes of premature death in all the population. One of the global targets is to decrease by 20% of the patients or the prevalence of this condition by 2025 or 2025. It's very important to have in mind which are the risk factors for hypertension. There are some modifiable and non-modifiable risk factors. For the modifiable risk factors are those that we can change. These include unhealthy diet, like increased or very high amounts of salt in the diet, low amount of vegetables and fruit, increased amount of fat or saturated fat or trans fat in the diet, or lack of activity. When you have a sedentary lifestyle, that can account like a risk factor, consumption of tobacco and consumption of alcohol. The non-modifiable risk factors are those that we cannot change, like age, race, and family history or genetical predisposition for hypertension. It is also important to know that some other medical conditions like diabetes, kidney disease can account for an increased risk for a patient to have hypertension. So that's why it is so important for you to get your blood pressure measured very often. Hypertension is a condition that is called the silent killer. What is this? It's because patients with hypertension sometimes have no clue that they have this condition because they don't feel symptoms. And maybe when they already have any symptom, it is when the condition is advanced or uncontrolled and already have some complications from it. However, when symptoms arrive, these could be very mild, from mild headaches, eye pain, hot flashes, it could have any vision problem, it could have also like decrease in the amount of urine production, and also can have some arrhythmias in the heart, vision changes, as I said, and patients can have dizziness, and these are some of the symptoms that you could feel. However, severe symptoms of hypertension can be blurry vision, chest pain, stroke-like symptoms like decrease in muscle strength in 1 or 2 of your extremities, tremulness, and these are very important signs for you to seek medical attention. It is very important then that if you are diagnosed with hypertension, you have a regular or very often follow-up or control with your primary care doctor. Whatever medication you are put on, You have to be very compliant, which means that you have to take it daily. It doesn't matter if your blood pressure numbers come back to a normal value. Most of the patients that I see, they stop the medications when they see that the blood pressure numbers are in the normal range. This is a very, very bad mistake. Why? Because your blood pressure is controlled and is in those good numbers because the medication's effects. Also, remember, the way that we can decrease the burden of hypertension is by increasing our physical activity, mostly reducing the salt intake in our diet, eating more vegetables, fruits, and avoid the consumption of alcohol and tobacco. Those are very important triggers for high blood pressure. Please follow up with your primary care doctor very often and follow all the recommendations. Stay healthy, stay safe, and happy World Hypertension Day.